you're live.
All right, guys. Hi, it's Dr. Emer, and it's Filler Friday. We are in the hot seat right now with one of our beautiful patients, and I'm very excited that he's here because he has a really unique facial feature. Remember, I was telling you that the look right now for men is a little bit more of a squared off jawline, a little more bold and contoured, but for his face specifically, it's very smooth and youthful looking. He has more angled contours. We actually don't want to widen him too much. We want to balance it out by bringing the chin forward slightly and lifting the cheek. And that's not always the case in men. A lot of the times you're actually wanting to square off the face, but if you did that, it would actually make him look disproportionate. So what we're doing here is we're gonna balance everything out. He's got beautiful lips that everybody already pays for, the perfect nose. So we draw a line from the nose to the lip to the chin, and we see there's a little space here. We need to bring his chin forward and a little bit back. A little bit out. Then we're going to lift this up slightly because when you start to hit 20s and 30s and you work out a lot, you exercise, you start to lose volume. This area starts to come a little bit low. He's a little bit more deficient in volume there, so a little under eye and a little lateral cheek will blend everything really nicely, and he'll have a nice enhancement that does have a little bit of what we call a feminine feature, but that's actually been shown to be the most attractive in beauty studies for men nowadays. So if you actually look at Ryan Gosling, for example, over the past 5 years, he went from beard to shaved face, more of a feminine sort of soft look. People think is very attractive. So this is what's happening more recently, where you have the curated brows, the really soft skin, a little bit more of angles on the face. Even though that's not as burly and masculine, it's still considered to be more attractive for a male. So we're going to start with the chin. This is one of my favorite treatments to do because you see the result right away, and patients get really excited about it when they see it. We're going to use Radius because it can go right onto the bone and give them a nice projection. Look up just a little bit. We're going to start in the middle, go right onto the bone, and give them a little bit of projection. You just go nice and slow. It feels weird because there's numbing medicine in here too. And literally within a few seconds, you can simulate what an implant would do for this area. And that gives us the look that we're going for. And the thing is, he's got great lips, like killer lips. Everyone wants these. So what we're going to do is to balance the lip, we're going to make the chin more even. Now when I first started this, you guys, Radius only came in one type, Radius. Now there's Radius Plus. Radius Plus has an interesting powdered form of lidocaine or numbing medicine in there. So you can use it actually very thickly to build things like the chin, for example, without having a lot of numbing added. This area tends to want to bleed a lot, so we just go nice and slow. Go ahead and put that Q-tip on. Good. We're going to move to the side. The key here with him is you don't want to go too wide, and you definitely want to build out what we call the lower cutaneous lip, which is right above the chin, so it looks like it's more of a sculpted look. It's more three-dimensional contouring is what we call it. Good. All right, so hold there for a sec. We're going to switch to the second surgery. Okay, so now I'm going to come over to here. Move around just a little bit. I kind of have to get right on. Good. So we go right again on the bone. Should be starting to get a little numb. This way. Great. The key is to get the nice proportion. Now, everybody seems to want to use the calipers and kind of do all this interesting stuff with fillers. To be honest, if you do little threads and you watch how it rises, you can really shape this out quite easily and make it look really nice. I'm going to give him a little bit more of a square look here. There we go. Okay. So just blend that. Now if you guys come to the side a little bit, you'll see how much more projected it is already. finish the fine tuning. Come back over here. Great. Let me see. I'm very happy with this. Really. I'll do that same thing where I create a little bit more of an angle right here. Turn it out to the side. Okay, we'll come to the opposite side. And this is more three-dimensional. We're looking at every angle here, just to make sure we can get this as even as we can. I actually wanted to show him this because it's so dramatic before we do the other stuff. You guys grab a mirror for him just really quick. Let me show you, because I know a lot of pokes, but look at that.
Oh, wow.
Now look to the side. See the difference?
Yeah, absolutely.
So now I'm much more balanced, you know what I mean? And even the neck just looks better.
Yeah.
So a little bit wider, a little more projected. It's gonna look really nice. And what I like about that, showing you that right away, because you forget what you look like, is then you can simulate what an implant would look like. And this is very easy. You can do this once a year, no problem. Whereas an implant's more of a procedure, but if we ever did a procedure, we would know the outcome.
Yeah.
You know, what it would be. So now we're gonna work our way up, which is great. We're gonna work our way up to being just slight enhancement of the cheek. I want to be very cautious with him because you don't want to make him too angled looking.
What filler are you using?
So I'm using a little bit of Restylane here. And how we're doing it is, with men, we go a little bit more superiorly with the injections on the cheek. Still onto the bone to get him lift, but a little bit more at an angle superiorly. What's nice about this is we can actually go a little bit towards the orbital rim with this and get a nice result. It's a safe area for that injection in that filler. But you see how just kind of pulling back here and placing this on the bone actually gives some nice shaping and kind of pulls the cheek up. Okay, hold right there for him. Perfect. Go to the opposite side. So the goal is to get this a little bit more defined and a little bit more lifted at the breaking point. And again, when we do this, small depot injections on bone, we go right a little bit more superior. He's doing great. It's not the best feeling in the world. So at least we're going to get that little bit of enhancement. The light definitely shows it right here, which is nice. And then some people call this a lollipop technique or picket fence. You go under here like this to get a little bit more of a lift. Again, our idea here is just to get some form of shaping, so we create a little bit more of an angle. Then we're going to use good. Hold right there. Now we're going to switch to cannula to make it less painful. I'll show you guys what that is. A cannula is not a needle, although it uses a needle to get into the skin. It's a blunt-ended instrument that helps limit pain and bruising. So let's see. Let's do the other side. Oh yeah, that was really good. Wow. Now we're gonna do on him a little bit differently. We're gonna come a little lower on the trough using Restylane Refine, which is softer. Go ahead and grab it there. And we're gonna work on going through the fat pads here up into the eye. So look, you can see where I am. Do you feel that at all or no? That's great. So even though we are basically directly in the tear trough, he doesn't really feel that much, and they're just small threads. We call this a pillar technique. Again, work the different angle, all the way up into the trough from below, going through the anatomy of the fat pads. And on him, you don't want to overdo how much you place under the eye because he's very flat naturally there. So if you put too much, it's going to look puffy. So we're doing these threads to just give some shaping. And all the way up here at the trough. Good. Now I want to hold here for him. Right there. Good. I'm going to go to the opposite side. You can see basically no bleeding. It's very minimal. Turn it over this way. There we go. We're going to do the same thing. We're going to work. We're going to work our way up through here. When you use a cannula, less risk of bruising and swelling. And see how I'm working my way completely around the eye and manipulate where in the eye we're going. Hold right here now. The other thing that a lot of people forget is the treatment of the lateral part of the eye. Now, if we kept it all in the middle, he would look a little hollow right here. So what we're going to do, we're going to come back here. We don't want this hollow. You see it's filled out here, but there's a hollow right there. Go ahead and grab this. Will balance everything much more. We're going to come right here on the edge. This feels a little weird. We're going to go right to the lateral part of the eye. You can see where I am right here with the cannula. I'm just going to do a little bit, just a small amount. And this is refined, so it blends really well. It will be basically unnoticeable in this area. Perfect. Just blend it a little bit right there. Great. So now, let's take that gauze, go right here. And then again, I'm going to use that little bit. You can see right there, turn a little this way. There's a teeny bit of hollowing, just a small amount. And then like I told you guys today on my Instagram stories, we talked about male facial sculpting. I always tell people it takes up to 2 weeks for you to really see the result. It always looks a little bit more than it does now. It looks a little accentuated. But that's why when you go to an expert who does this a lot, they'll know what to anticipate and what should look like now and what should look like in a week or two. Perfect. So we just soften right through there. Great. Alright, so now hold right here. And we're done. Now we're going to wipe him off. to wipe him off. We're gonna show him what we did with just a few syringes to really give some balancing, some softening to his under eye, and an improvement in the lateral cheek. Obviously with a little bit of swelling right now, but honestly, to me, take a look, I think
Oh wow.
really nice.
Yeah.
You know, so
Oh
look,
my
a
God.
little more lifted. This is projected, so when you have that, now remember, this is for your facial
Yeah.
shape. A little bit improvement here. There's still a little bit of hollowing through here, but it fits you because you're naturally, you have more of a bony structure type of face, so it's okay. We don't have to fill everything, but eventually we work our way with, you know, slightly filling through here, here, and here, but everything is more balanced now, you know, and it looks very natural, and your eyes look a lot better. He naturally has darker under eyes because he has not only pigmentation, but also a little bit of hollowing, so we can work on the pigmentation in the future with things like Cosmetic peels and aerolase laser and some other things, but now it's softened because we did the filling. So we have a great result.
So
We'll
good.
show everybody pictures in the future, and he's gonna red light now and then enjoy the weekend in LA. Have a